What resources did you use to study for the DAT?
I did. Oh, that's a good question. I did the Kaplan course. I don't even know if that's still around. I imagine it is. It was always a big one. And I probably went through their entire book, and I can't remember what other ones. Honestly, there was a lot of online different banks at the time that you could get questions and exams. I would definitely recommend sitting that entire exam in kind of a similar setting, giving yourself the same types of breaks, just to kind of get used to the stamina of answering that many questions for that many hours. Um, I took my exam in the summer of third year. I know that was a good time that worked for me. It might not be a great time for everyone, but depending on which programs you're applying to, um, if you have a summer off, that's probably the best time to do it. I didn't want to do it while I was in my full course load during university.
Good call. We do have a few of those resources now. I'll put them in the chat, or I'll send them with the recording as well. It's DAT Crusher, Mental Dental. There's a few resources that have.
Those are sounding familiar.
Good, yeah.
Yeah, DAT Crusher sounds familiar. I definitely did that one.
Perfect. Yeah, we have a few of those links and resources we can share with you guys as well. Could you please go over the board exam one more time?
Yes. I don't know exactly what you want me to do, but we'll tell you about, but there's two parts to the board exam. So one part is a written question format that you do over an entire day. So I think it's a couple hours in the morning and a couple hours in the afternoon. I can't remember exactly how long it is, but you get a study set of questions. I think you get the questions from the year before you. And as I was saying, I would try to go through as many questions as you possibly can, because they really repeat the type of questions they ask. They might not be the exact questions, but they'll give you a very good idea of the formatting of the questions. And then the second day is it's not fully clinical, but you get clinical scenarios and still answer multiple choice questions based off of those. And again, there's lots of practice resources for these. Those ones were very consistent with the years prior. So just really looking in, kind of knowing not only studying everything, but knowing those previous questions and having done some of the test banks. But if your exams are at the same time as your finals, you're going to have been studying for them anyways. Like, you'll know that information.